important challenge a family can face is normally initially they said 14 days of self-isolation. Now, to take a positive mother back home, if the family members are negative, what are the safety measures a family member is advised to have the positive mother at home? Or positive mother have to be handled in a separate residential area or separate isolation zone for the first 14 days?
Absolutely. The individual, whether it is a pregnant mom after delivery or anybody, they have to follow the what is it, the quarantine protocol. And the quarantine protocol says it is 14 days. In this case, because the mom has become a COVID negative, she can be asked to go and isolate herself. And the baby is also a COVID negative. The baby can be handed over to the mom and they can be in isolation. And after 14 days, they can be back to and mix up with the individuals. So what the mom is supposed to do is the surface cleaning, washing hands, and keep the baby as far as possible, except for nursing. If she wants to breastfeed the baby and have the satisfaction of breastfeeding, then the skin should be adequately cleaned, as explained by the healthcare person. And and she should don an N95 at the time of feeding the baby. That's a mandatory requirement.
Thank you.
And and the baby has to be given on day one. We did give the baby the normal vaccination as per the standard protocols, which included BCG, oral polio,